Qualcast Nation, we have a very special episode. We have the one and only Christine Harrison from Focus Forward Therapy Group. And as you heard in the intro, I wanted her on the show because I feel like she is an innovator in terms of the health and wellness space. She lives what she preaches, and she's really serving our community at scale. So, Christine, welcome to the show.
Thanks for having me. I almost felt like I was supposed to flex or something. Like she lives where
Oh,
she
do it.
preaches.
Yeah, do it. There's no reason not to. Let's
Oh,
go. Let's go. Yeah, in case you guys don't appreciate this, Christine is jacked. And we'll talk a little bit about MPAA at the end, probably here. But tell us a little bit about your Focus Forward Therapy Group. What got you involved? What makes you unique? Tell us all the things, Christine.
well, I love that you describe me as an innovator. So I started Focus Forward Therapy Group in 2014 as a sole proprietor. Had this idea I was going to go into private practice. I'd always worked in healthcare, always in nonprofit. Started my side gig, did my hustle like we do. Started to notice that some of my approaches were really standing out and I was having a hard time keeping up with caseload. Brought in a couple of clinicians to join me. 2019 became large, scaled up. We have two locations. We're opening our third. And I've really noticed that, we're doing things differently than other practices out there when we talk about health and wellness. And I love it. And I love that it's contagious. I love that I'm on here today talking about how to change the game. We're not doing therapy in the back of an office in some building with no name. I wanted street front and center, big signage. We're right beside dentists. What are you coming for? You're doing tutoring next door? Normalize. Let's just make mental health and wellness a priority.
Amen. I love this. Destigmatizing mental health. And once again, you're pioneering this approach of taking away the blinds here. So what are some of the ideas, principles that make you guys unique?
I would say that our approaches are really eclectic. So of course, we can always talk about therapeutic modalities. We have our CBT, we have our psychodynamic, we have our emotion focused, and sure, we follow the client, we figure out what they need. But in general, I think this normalized process. So we really have this term that I've coined, boutique mental health. And it speaks volumes to the way that our locations look like. Have you been to those like fancy dentists? And you have three kids, so you probably live at the dentist. And I said last night to my husband, nobody texts me more than my dentist, managing all of the kids. But I go into these dental offices and they were beautiful, right? The waterfalls and the coffee and the beautiful cups. And I thought that is what mental health needs. And so we have this really beautiful setup in our two clinics, normalized. Come in, have a coffee, let's chat. Tag us on social media, take a selfie, right?
Mm.
So the idea of really encompassing normalization in our practice is really important. We also, I would like to say, keep it really simple. I don't want to poo-poo any of the clinicians who work here, and we have a variety of different folks who work here, but we really keep the principles really simple. Your life is about eating, sleeping, and moving first. As you know, this is what you preach, right? If that foundation isn't solid, the rest of the human house is shaky. Well, how
Mm.
how am I going to manage, working on your anxiety with you or, challenging a different situation unless we've really established eating, sleeping, and moving? And so I would say that we keep these basic principles really simple.
I freaking love this because you don't like I feel like a lot of areas in healthcare, health and wellness, we silo ourselves. And if you think about
Yeah.
even if you think from a mental health perspective, I mean, I recently had a psychiatrist on talking about how the impact of exercise on mental health and showing like it's just as effective as some of the medications, right? And so this is to me a clear sign that lifestyle matters. So how do you, how does
Absolutely.
yeah, exactly. And so like Christine, so I walk in the clinic, I'm coming in there, I'm concerned with my anxiety or I'm concerned about my mood being depressed. Walk me through the process. Like, is there an intake form? Is there an interview before we start coming up with recommendations? Like, walk me through what would it be like walking into your clinic?
I'm really glad that you asked that because a lot of people sort of expect a very medical model. And I except, we'll talk about the ketamine later because that is a little bit more medical because we're doing medicine. But this isn't a medical model. This is self-referral, email, call. We have admin, we have email. Go on our Instagram. We'll reach back out to you and say, here's our number, give us a call. We meet with people on a very human level. And I think fundamentally, I believe and try to instill that within all the clinicians here that there's nothing more important in life than relationships. That relationship with the person you're seeing, the relationship with yourself, your family, whatever that looks like. So that's where we start. Meet them, they come in, we find out, hey, what makes you tick? What do you do? What do you do for work? Do you work? Who do you live with? What time do you get up in the morning? What time do you go to bed? What did you have for breakfast this morning? Right? Give me a little history of what things were like. We build that biopsychosocial in a very normalized approach. In the back end, we're doing all our clinical charting, checking our boxes, of course, to make sure we're following the principles of our college and, all of the things that we're supposed to be doing. But together, we come up with a plan that is going to serve that individual based on what they've identified their needs or maybe what we've picked up. So, one of the questions I might say is, when's the first time you go outside in the morning?
Mm.
We know that our circadian rhythm needs sunlight in the morning. Well, if I'm hearing that people are sitting at their desk all day, not that I'm poo-pooing coffee, but if you're sitting in front of your desk all day and you're just typing away and you haven't seen sunlight, yeah, right? How are you going to get to bed at night? How are you going to fall asleep? So we just basic principles of eat, sleep, move. Okay, now let's talk about the anxiety. What kind of meds are you on? What are your goals for meds? How's your physical health? So
Mm.
we have a spectrum of folks that we'll see who are coming in who, aren't on any medication, and that's great. Maybe they don't want to be, maybe they don't need to be. Medication serves a purpose, as you know. But we also have a large population coming in with metabolic health syndrome and who have either had sort of a lifetime on medication or, multiple medications, and we're seeing this deterioration in their physical health. Well, you know what goes up? Anxiety, depression, social isolation, deep sadness.
Mm.
So back to the answer to your question is when people come in, we form a relationship because
Mm.
that is really important when we're trying to support somebody, knowing that we're here to serve them. We're here, we're available, and we're just two people who are working together to improve your health. That is a normalized approach to mental health, in my opinion, my very humble opinion.
I mean, you live it and you're seeing the results. So I think it's far from humble. So when it comes to the eat, sleep, move, did I get that right? Yeah, eat, sleep, move. What are some of the principles, at least from let's start with eat. Like, what are some of the concepts that you try and um, hone in on or trying to improve for your clients?
And it really depends on their starting point. And I think because we all sort of follow this, fairly fluid model. Let's say somebody's coming in and they're just not eating. They're just restricting eating, whether that's intentional or not, but you see a lot of people who don't eat all day and then just kind of go through and eat through the evening. So we might start with let's just talk about eating during the day. We might not necessarily focus too much on what you're eating during the day, but let's just try implementing that. So although these strategies I'm talking to you about are very normalized, eat, sleep, move, we are applying a cognitive behavioral therapy approach to everything that we do, right? So whether that's through sleep training or, changing your behaviors, your habits, it does need to start in those incremental steps, right? Where you have a clinician who's leading you along the way. That's how you gain success. So if somebody's not eating, we're just going to talk about eating. Now, if somebody's eating and maybe their choices aren't ideal, that's where we're going to see an increase in anxiety and depression. So a lot of processed foods probably are being consumed. Perhaps, like a high amount of sugar, artificial sweeteners, flavors. And what I see a lot is low protein intake and high refined carbs, right? So, I know that there's a lot of things that are coming out around nutrition being purposeful within that lifestyle medicine model. And I'm really excited. This summer, I'm going to Harvard to further expand some of my training on the idea of this lifestyle medicine and food being medication. And, we need to start with whole foods. I know you preach this all the time, and I've heard with your intermittent fasting and, the protein powder, whatever it takes. I want to see protein consumption throughout the day. And then we talk a bit, because again, that CBT model is getting put in there. So then I want to learn, well, what do they know about protein? What do they think protein is? And you know what I hear all the time? Peanut butter. Peanut
Oh,
butter is a fat. We know it's delicious, but it isn't really your primary source of protein. So there's a little bit of psycho ed that comes up where we bring them into the mix that they can have some expertise and some role in developing this, because that's what's going to stick, right? When you're trying to
I
change
love it.
behavior, you need to not talk at them, right? Be able to encourage a two-way conversation through that relationship. And
I
water.
love.
Oh my gosh,
Yes,
nobody drinks
yes,
water.
yeah.
Nobody
No,
drinks water. How much water do you drink a day, Dr. K?
how much do I do it? So first thing in the morning, I have almost a liter. Just like I just take out my Nalgene, I'll just s- put that down just to give me a good start to the day, and then it depends how active. I'd say anywhere from 2 to 4 liters of water. I'd say, like sometimes you forget, and
You're
if it's
busy.
a 2 liter day, then it's a busy day. Like I'm not thinking. But most days around four, especially most days I get a workout in, so yeah, I think about that. How about you, Christine?
Um, I do 4.5 liters. And like you, I've got about a liter and a half in before 7 o'clock. And and adding electrolyte into my morning has changed my life. But the big thing with water is I have a really hard time in the therapeutic relationship with folks when their brain's dehydrated.
Mm,
But then they're demanding so much of themselves, and there's so much self-imposed pressure around, well, I should be better. Why am I still feeling like this? And then we start to pick away at the eating and the water consumption. We start to see those deficits. These are just, and I know everybody knows this. I know they don't need to come here to pay me to tell them this, but there is something about kind of hugging and wrapping around somebody um, to help support them that makes that difference, right? And then we can start implementing the other things. Well, what would be the barrier in self-care? There's a
mm.
lot of guilt and shame, particularly with folks right now, for whatever reason, whether it's the state of the world or it's the state of the past 5 years of the world. It's been a really challenging handful of years for folks.
So guilt and shame, like I think. I mean, sometimes I need to think about this harder. I feel like I look at those two different in
Mm.
two different ways, but wh- why guilt? Like I could see a lot of anxiety right
Mm.
now as an example,
I,
but yeah, I'm
yeah.
curious.
Yeah, and anxiety, remember, is sort of a symptom of other things. So when I say guilt and shame, I do think a lot of it has to do with unrealistic standards that are kind of being set in the world. And a lot of that is, social media. Well, you and I both know we have a large social media presence. We see what's out there. I appreciate, Dr. K, that you keep it real. Right. And I think that's really important. And we try to do the same thing with our social media, but that's not what everybody's viewing. We can't control that. So when we talk about, diet and lifestyle and mental health, some of those questions that come up are might be like, how much time do you spend on social media? What do you do? Right? Because we know, are people getting caught in that rabbit hole of scrolling and what's happening, and maybe the little psycho ed and dopamine hits, and how do we actually decrease that? And sometimes we do dopamine training. So cool. I don't know if you've ever done it, but it's actually so effective for your brain. So The secret is that we're coming in and we're changing your brain, your neural pathways, neuroplasticity. This is psychotherapy, but we're doing it in a really normalized everyday conversation. And that takes a particular skill set and a particular way of approaching it. And in my opinion, it's been very effective. Guilt and shame is just rampant for in many generations for different reasons. Maybe my generation might have just been the way boomers were. Sorry, sorry, mom. The way boomers were raising us. And now I think it's just the social media and the presence in the world to sort of be perfect. And we're
Hmm.
seeing this, right? We're seeing kind of unraveling of people's mental health with these standards, unrealistic standards, both self-imposed and real pressures.
Yeah, it's funny you said that. I was at a dinner, or sort of a dinner, like après 5 à 7
Mm-hmm.
yesterday, and I was a bit late, and the people there wanted to order some fries and some stuff like that, and then they were like, "Oh, but Dr. K's coming. He's gonna be like, oh, where's the protein at?" And then I'm like, "Is that? Do you guys really think I'm that strict with the way I approach things? Like, as you mentioned, I try and keep it as real as possible and practical. But you're out with your friends. Of course, you can have fries. Of course, you have pizza. Of course, yeah, you get to live. But
Yeah.
it just gave me it reinforced that point, Christine, that the messaging, we got to be careful in general, like about like how much shame or guilt we could be putting on people if they have this perception of this perfection. And yeah, it really made me pause and think about some future content ideas actually, and just saying like, hey man, I'm human too. I scarfed down a pizza today with beer, and I, don't feel great, but tomorrow I'm going to be eating better. You know what I mean? Like, yeah, it was just an eye
You
opener.
know what? Love that. Macros don't always supersede memories, right?
Yeah.
And so I think it's really important to be mindful of your choice. So we talk about mindfulness in therapy, right? Mindfulness in your life. What's important to you? Hey, are you looking forward to going out on Friday with your friends, your girlfriends? You can have a glass of wine. Great. Enjoy it. But let's talk about during the week. What does that look like? And, we might talk about alcohol because alcohol increases anxiety for, 3 days after consumption. So if you're already an anxious person, consuming alcohol probably isn't your best friend in that moment. And so we do a lot of psycho ed within our motivational interviewing to see where they're at. So I think it's important that you let people know you are human. I also just want to touch on something. You can't make anybody feel guilt and shame, right? Those are their feelings, and that has to do with them and how they feel about themselves. I think being a healthy role model for people is important. I will say there's a category of folks that we see here that I think just the nature of the atmosphere that we have. And we work a lot with high functioning, executives, high functioning athletes, and one of the really interesting things is that they are human, but this pressure that nobody thinks they're human or normal actually really affects them. And so we see that, the high performers that walk in the room, people notice them. The biggest indicator of being a high performer or being somebody who's a leader is actually your physical health, which is mind blowing, right? Because it actually has nothing to do with what people think.
Whoa, whoa, whoa. I want you to say that again because this is the first time I've heard this. Say that one more time in terms of.
No, it's anecdotal, but you walk in the room, and if you are commanding attention, people know who you are, people are drawn to you. That is because of your physical health. Because you may work in a job where you are well paid, you're well respected, but if your physical health isn't doing well, maybe you have metabolic syndrome, maybe you have unhealthy lifestyle, and that's apparent, that takes away from the amazing things that you do. Because physical health, although there are some factors that are beyond our control, right? But for the most part, you are fully in control of your sleeping and your eating and your moving. And when you learn to master that, that shows in your health. You cannot buy that or fake it, right?
Hmm. I love that shit.
So
Actually, I might steal a
there's
little.
the mind blow.
Yeah, no, I might steal that a little bit. Like, I just because there is something to your physical health and how you're coming across. I got I think when you're eating well, when you're moving well, when you're feeling good, you're restored, you're sleeping well. There is that change in posture. There is that change in confidence. There is that change in presence, and it's contagious. That charisma, that presence is amplified. And I recently talked to somebody that it's funny. They had an amazing event and an achievement, and they weren't happy with where they were in terms of their health. Like he or she was, we'll say, 20, 30, 40 pounds over where they wanted to be. And it took away from their experience. I mean, my personal opinion was like they still had some great presence, but for their personal experience, like they were in their heads thinking about their appearance as opposed to just being present and enjoying this amazing achievement. And it actually made me a little bit emotional when they were telling me this, because I'm like, you should be so proud of what you accomplished. And but it's so sad that you're in your own head about how you look. And I'm not one to say like, hey man, we all gotta be pretty and shit. I mean, I'm anti dad bod. Like, I'll just be honest with you. I'm like, it'd be nice to have a movement for guys our age to say like, yeah, let's get pretty. But it's not for the sake of being pretty. It's for the sake of being strong and confident. Um, but this long-winded way of me saying that, I think you're onto something about how we feel physically and how that comes across in our confidence and how we execute as leaders.
Right. There's a
Yeah.
neurological reason for that, which you probably know about because you're very talented. But you've heard of growth mindset.
Hmm.
Have you this term where, when we do hard things, our brain goes, "Holy shit, I did that." And then it goes, "I can do something else. I can do this. I can do that." So I'm a big fan of setting goals. So I love that you just said there's a movement for guys my age to be anti-dad bod or to be in the best shape. When they start to meet milestones, this is where psychotherapy comes in, right? We start to set some goals, move towards them. When they meet those milestones, with each progression, there's a little check and a little neurosequential change that happens that tells you, I can do it. Well, that's where your shoulders come back and your head comes up. So this is they go hand in hand, and that's why therapy is so effective for meeting your goals. It's not Therapy isn't just come in when you're not feeling great. And it is for that. And come in when you're not feeling great. Please call me. We'll help. But it's also when you're feeling great and you want to move to that next level, like you said. So that person that you're talking about that didn't feel their best self, that hurts too. I feel that that they weren't able to sit in their accomplishments because of how they felt their exterior looked. Therapy supports that, right? Supports it so that you learn to love yourself and accept, but also know that you can make changes and empower them.
Yeah, I just, once again,
Full
Christine, just
circle.
love. Yeah, I just love how it just how holistic the approach is. How you're dealing with physical and the mental health side, and how it's intertwined. I just I don't know. I just think it's wonderful. And this is my bias. I know this is not the general public stuff, but we do have a lot of high achievers or wannabe athletes that listen to the show. Like, what are some of the other reasons people come to see you? As you mentioned, there are some kind of unique properties that the high achievers have. So I'm curious to hear why they're drawn to you.
Well, I think maybe from one high achiever to another, there is a bit of shared lived experience, and that can be very helpful as well because it does, we don't all have to have all of the elements to help support people, and that can be, sometimes a barrier for folks. But yeah, one high achiever to another, that is helpful. Plus, there are particular traits that we're aware of within kind of that development of a human. So we often will go back. So sometimes we might do a real psychoanalytical dig um, and figure out what is kind of that precursor because we know the brain can heal itself, right? It's plastic and it can be rewired and moved. So I'll often do like a little diagram, like, here's your brain. Look at how professional this looks. And here's your brain stem. And then we try to figure out because high achievers love this stuff. It's great. It makes sense, right? We love these visuals and metaphors. So we'll talk about, well, when did you figure out that, this is how you gained attention? Or when did you get praise? And we can go back and heal that once we learn where the development was halted. That's the really cool thing about the brain. High achievers also love the environment. We know that goal setting is really important, accountability, structure, right? And I would like to say that I'm so proud of the team that we have here because they all live and breathe this model themselves. Healthy lifestyle, we sleep, we eat with intention. You're never going to see a fuller fridge of people bringing their lunch. And
Mm,
when you work in an inter-collaborative environment, that's not always the case. And
mm.
so being able to model what you preach, and I hope we don't preach, I hope we educate and I hope we just share experiences, but I think that goes a long way for high achievers. We also are a little bit forward thinking. The name kind of is a little catch, unintentional, in the treatments that we offer because we're bringing in other things. Like I mentioned earlier, our ketamine medicine clinic which opens next month. And, the idea is that not everybody wants to take SSRIs. Not everybody wants to have medication on board, and that is their perspective, or maybe they want to move off of it. Ketamine is another option that doesn't have those same physiological effects and or metabolic issues later on in life and is very effective for treatment because of what it does to the ripening of that neuroplasticity. So there's a medicine administration and a therapy, and they go together at the same time. It's very cool.
Brilliant, brilliant. And so, just so to timestamp it, we're doing this interview mid-April, and so in May, Christine, the ketamine clinic will be open, and it sounds like, and I'm I've only superficially evaluated the ketamine and its potential impact on, I think it's depression and anxiety, but from what I could see, it sounds like there's some promising results.
Mm-hmm. The results are immediate. So one of the nice things about ketamine, if you've ever had folks in the OR who, maybe are receiving an intravenous ketamine for something they used to be awake for, but there is an immediate feeling of well-being in particular, when administered in a psycholytic state, which is what we are doing. We aren't doing psychedelic doses. We are doing psycholytic. So I just refer to it like the baby dose, right?
Mm.
You're cognizant, you're communicating, you feel like $1 million. You're like, shut up, I feel amazing. And it's not a euphoric state. It's this real feeling of contentment. Well, to anybody that has depression, to be able to offer that to them, that makes me emotional to know that we'll be able to offer that to folks who have really been struggling. And then there's this neuroplasticity effect that happens, this ripening, and it kind of happens at about 48 hours after the administration of the medicine, where they come back and they have more psychotherapy, where we review some of those goals that we set together and we further that process. So the leaps and bounds they can make in therapy are shortened to, between 3 days, what you can do that could take, may I say, even years. I have been working with people for 10 years um, and it's just amazing. I'm super excited.
Wow. No, this is what I mean. I think what drew me to you, Christine. Well, we have a mutual friend and Jen Stewart that put us together. But what drew me to you was the idea of being forward thinking and moving the needle in terms of how we can approach people's wellness, because a lot of times we try and look at things the same way that they've done, and just try harder as opposed to looking at innovative and novel ways to improve people's lives. So I really want to applaud you. I, I I- I'm curious, is that, without, I mean, obviously giving too much detail, is there a story that comes to mind that someone from Focus Forward Therapy Group, like a client that has come in that has had like a result that would be incredible? Like, is there a story that comes to mind about any of your clients?
One of the really interesting stories that I have, I mean, there's actually several like this. I could give you a laundry list of these stories, and they have to do with goal setting. That's where I really see the fait accompli with it, right? Because I get to see them from the beginning, and then I get to see them at least to that first goal. It's not the end because there's no such thing. We're all circling the drain. The end is when we're done. But when I see the goal being met and then the trajectory for further goals, those are great stories. And I see a lot of that when I see athletes or weekend athletes or folks who just want to make change in their life and they set a goal. Hey, I'm training for this, or I really want this promotion. And we start to intertwine all of those pieces with cognitive behavioral therapy, whether that's through, morning walks, increasing their water, journaling, coming in for therapy, unpacking some of those boxes that are cluttering up there. Then they meet their goal and I see the big change that happens after. So for some people, they, some of the not so great things in that moment, but that were really what they needed was some people change relationships.
Mm.
I've seen people go back to school and say, you know what, I'm going to go back and do my master's of nursing. I can't tell you how many people have gone back to school. Um, People are setting new goals for work, changing careers. Those are the big stories. Those are like the big, like, holy heck moments that I find sit with me. There's always the really amazing stories of people who have made peace with something that's happened in the past, who have made a connection within themselves of why they feel or why they're acting a certain way. We we use the term, I don't know if you use this term, but the term woke when people really identify understanding themselves and understanding, hey, I can actually create my own positive mood. I know how to do that. When I go for a walk in the morning and I get the sunlight in my eyes, and then I come home and I make a healthy breakfast and I head to work and I live with intention and purpose, I feel connected to myself. This this is where everything changes in the brain, right? And that's when those connections start to happen and then serotonin release. I mean, I'm making it sound really simple, and my apologies to any scientists or other clinicians here who are like embarrassed by my explanations. Um, but those are the stories that really sit with me, and I remember those, or an email from a parent saying, thank you for helping me organize this at 8 o'clock last night, which was an email I got this morning that was just so lovely to get. So those are the things that stick with me. It's not that it's all about me, Dr. K, but these are the things I remember.
It's what keeps the engine running, like it's those testimonials, it's the lives that are being impacted. It's why we do what we do,
Yep,
so those are important, and how we feel allows us to show up as our best selves. So I wholeheartedly
I
commend you,
agree. You
Christine,
need the
for all
passion.
your 100%. I Before ending off, I do want to give you a chance to plug some of the bodybuilding work that you've been able to do, and because I think once again we were talking about how how your physical health and your physical wellness translates into your mental health and to your leadership and so forth. So, can you tell us a little bit about MPAA?
Yeah, absolutely. So NPAA is a bodybuilding federation that is hosting their first show in Ontario this May 3rd, down at Labo Theatre at Ottawa U. And I am the promoter for that show. This opportunity is really important to me. Came around from Dr. Wendy, Dr. Kevin, who are out west, who founded the Federation 12 years ago when they started following me on social media. So here's another social media connection because, relationships happen online or in person. So I had founded a nonprofit for women in bodybuilding in 2020. COVID was around. Some of us had a little bit more time on our hands. And I decided to start up this nonprofit for women in bodybuilding. I can tell you that those couple of years when we started that and the change that I saw in women impacted me so profoundly that it really identified that even myself as an athlete, as a competitive bodybuilder, that no longer did it for me. I no longer was my own goals no longer filled my cup. I exclusively found a deep satisfaction in watching other people fulfill their goals. And so that was a pivotal shift for me. So when Dr. Wendy and Dr. Kevin approached me and said, we've been watching you, would you promote our show here? Once we worked out the logistics, which probably took about 8 months, I am fully on board with this show because I know what goal setting can do. So this NPAA is both men and women amateur athletes who may want to go pro. So we are affiliated with the Natural Olympia, and we'll be going to Vegas in November, which is very exciting. Team Canada, first time ever heading to Olympia. So this is an opportunity. We have a transformation category, which is amazing. So if you've had any transformation, that can be anything. That can be weight loss, that can be you've recovered from surgery, from illness, and you want to come and show your progress before and after. And it's in athletic wear, that category. We want you. We want to hear your story. We want to hear what you've done. We want to see you on stage because I know what can happen when you meet a goal like that. I almost want to say, like, just trust me. I promise you're going to feel so amazing after.
I, I love it. And I know. Actually, I don't know if she'd be good me telling, but I have a friend named Kim that had a very significant body transformation, and I mean, she's on social media flexing, and I'm just so proud of how much she's transformed, and I see how it's changed her life. She's going from somebody that would be at risk of seeing me in the ICU to somebody that is legit, like completely changed the trajectory of her life. So I love this, and this is why I mean we're I don't know if we're allowed to say this, but I'm going to say this anyway. But that's why we're partnering with you in terms of guided nutrition, because we love that message being guided strong, being focusing on not only how your physical strength is being amplified, but how it affects your mental health and so forth. So really excited to be partnering with you guys.
Yeah, and we're excited to partner with you. And I think it is okay to say it because I think in healthcare, we need to be transparent and clear and honest about our intentions and what we're doing. And I am really proud to have this product created by a physician to be able to be given to our athletes and to everybody else, to the folks who aren't eating all day and let alone consuming protein. So I'm really excited to have you in the clinic.
Amen. So Christine, this has been awesome. Where can people learn more about you personally, learn more about the clinic? Where do we want to send people?
Focusforwardtherapygroup.com is our main website. You can Google boutique mental health. You can Google Ottawa ketamine. You can Google me. You're going to see a lot of my bodybuilding information out there. I would encourage you to go to our main website and we can direct you from there. You can email us at info@focusforwardtherapygroup.com. And you can also follow us on social media on Instagram at Focus Forward Therapy Group.
Amazing, Christine. Once again, thank you so much for jumping on the pod. And I know I only see success amplifying for you.
I appreciate you. Thank you for the opportunity to share in our like-minded thoughts around wellness.